Hey, what's going on, everybody? Dr. Howie here, and I want to introduce to everybody Angel.
Hi.
Angel, do you want to give everyone a chance to talk a little bit about yourself and a little bit what's going on with your body today?
Yeah, so I come to Howie, once every week, and he takes care of me. I do Jiu-jitsu pretty much every day, so I'm always pretty beat up, and lately I've been dealing with a shoulder injury that he's been taking care of, so it's getting there, but it's still, I have some issues, and I have a competition tomorrow, so we're going to try to get it right today.
Okay, so we got competition tomorrow. We're dealing with a shoulder injury that's been going on for a few weeks now. And I do know that every time we do get adjusted, it does improve there. But again, we are a pro jiu-jitsu athlete, a sport where you're literally trying to break limbs and choking people. I can see how the shoulder will still have some limitations here. And so I want to also kind of get in touch with sort of like, you have competition tomorrow. What are your stress levels right now with that? And how much of the shoulder pain or limitation is creating that stress for you?
Okay, so that's a complicated answer. Well, I'm cutting weight right now, so I'm pretty stressed because Mother Nature is just not on my side. So I'm like gaining weight when I need to be losing it. So the stress levels are a little high. I'm trying to like just keep calm, but I'm not like eating or drinking enough water. So you can imagine. But with the shoulder, it's like a little bit stressful because I do like to invert a lot, and I invert on that side mostly, which is probably a big part of the problem. But I kind of have this mentality, like when I'm competing, I don't feel anything. So like I know when I'm in there, I'll just deal with the pain later type of thing. So I think the stress is more cutting weight, and then once I make weight, then I can worry about whatever else. But yeah, the shoulder, I would like to go into it as healthy as possible. I think, when's the last time I went into a competition completely healthy? I can't remember. So I would like to try to be as healthy as possible.
Absolutely, absolutely. And one of the key points that Angel touched upon was there is an emotional stressor right now in terms of the cutting weight, the process of getting to the competition. And I want to just kind of go a little bit deeper there is we can acknowledge the stress that we're dealing with right now. How do you think your breath has been throughout this week with that?
Actually, that's a good question. I've been trying to be mindful of my breathing and like take more time like just praying and meditating and trying to stay at that baseline, just like calmness. I've been only listening to classical music for the last couple weeks, so I've been trying to like stay in a place of like a meditative state, I guess. So I have been working on that because that's one of the biggest things you always tell me about. So
that was going to be my follow-up question. Was that a strategy you implemented after starting care here?
Yeah, like I've always like been into yoga and meditating and stuff, but I think like you've broken it down to me, like the emotional factor and like my lack of conscious breathing lately. So it has been something I've implemented more since working with you, and yeah.
Awesome, great. Well, let's go and get Angel assessed here and let's get her adjusted, and let's see what we can do for Angel for tomorrow's competition.
Thank you.
Cool. All right, we got Angel here face down. The first thing I'm gonna do is just make sure Angel is nice and straight as possible on the table. So let me just move this hip over just a bit, great. And what I'm gonna look at is just more of just a global scan of Angel here. So just take a deep breath in for me, Angel. Good, and let it go. All right, so you can see a lot of the breath is coming up from here. All right, and you know, we did talk about earlier a lot of the, we did talk earlier about some of the emotional stressors that Angel's dealing with, and we're making that effort to breathe and be more mindful and have that meditation. But what I want to do is for Angel here is to cue breathing here in the low back. So breathe right here for me. Good, and letting that go. That way the breath starts in the low back diaphragm area, then we can pull that up into the chest shoulder blade area. One more time here, Angel. Good, and letting that go. Right, we want to think about a breath that is more like a rest and digest type of breath rather than like a very stiff fight or flight. And I work with a lot of individuals who do have this report of like they are feeling stressed, they do feel that lack of breath. And so the first thing before we even adjust here in that mid back where we know there's tightness is to just allow the patient here on the table, just breathing. Good, right there, let it go. And you can start sensing the body start to relax, sinking in. One more time for me, Angel. Good, yep, letting that go. Great, and we're gonna start with that adjustment right there on the mid-back. Because what I'm feeling right now is from a fascial standpoint. Fascia is actually like really nice and relaxed here, but the rib cage, the spine itself is very compressed. So what I need to do is actually use the fascia itself to allow a little bit more sinking in. So I'm going to grab that layer of fascia over, gather the ribs, and we'll come straight through. So breath in for me, Angel. Good, and let that go for me. We'll gather that through. There you go. And take that big breath in for me. And let that go. Let's check out the traps, shoulder, and necks. Oh, neck. Let's check out the trap, shoulder, and neck here. Because we are talking about shoulder discomfort and pain. Biggest thing we always have to consider is how much of the neck, the cervical spine, is involved here. As I'm checking out Angel's traps, necks, and everything, I'm feeling a lot of tightness here on that right side. And so what I want to do before I adjust is just to see, as I'm setting up the adjustment, if I bring her head over to the right side, what does that side feel like? It does feel a little bit softer. But I also want to see what it feels like the other way when I'm pulling it this way. It seems like this way is actually what Angel's system prefers. So we'll go ahead and adjust going that way. Okay? There you go. I was wrong, actually. There you go. Now, one of the things, especially when we're talking about the shoulder, that I hear a lot is a lot of people talking about that spot, like in that shoulder blade, that rib area, right? She's nodding her head, where they're having a lot of that discomfort, okay? All right, so you saw a little bit on Angel where I was kind of pointing to kind of this part, the ribs right between the spine and the scapula. This area right here in that shoulder blade is an area of tightness, tension, hypertonicity for a lot of people. And the cue I get a lot of people is they'll do tennis ball work there and everything, but just doesn't feel like they can get out. There's like a knot or something that they just can't get out. And this adjustment is going to be really beneficial for that. So let me show you here. Press that shoulder down, roll Angel over. From here, there's a spine. I'm gonna just hook right into that spot. Yeah, there it is. But when it comes to the shoulder, we can't just adjust the back part, the ribs and the scapula. We also have to think about the collarbone, the clavicle, and the AC joint itself. And so if you look here, this is a lot higher, and we want to bring that down and back for Angel here. So go ahead and cup your ear for me. Great, perfect. Feel okay in this position? Phenomenal, cool. We're just gonna roll that shoulder over. My other hand's gonna be right there on the shoulder blade again. Let my other hand just sink into the armpit. How's that feel here, okay?
Yeah.
Great, then I gotta take it into the direction it wants to go, which is down and back. I got you, Angel, and go. In the sport of jiu-jitsu, armbar is one of the most common submissions, all right? And if you can look, elbow can only really bend so far more in extension, right? So if we could just help Angel get a little bit more range on the elbow, that's gonna be a lot more helpful there, right? Every inch matters, right? Then we'll take that wrist. Good. From there, go just straighten yourself out. Good, good, good. Let's check out the neck. Put it right here, yeah. So I'm still feeling a little tightness on that right side. And I think this will be the last part because you gotta keep in mind the nerves in the neck and the cervical spine, especially C4, C5, C6, do innervate to the shoulder. And so we can create some decompression here in the system that should be able to make that shoulder move a lot easier. So let's sink in through. One more. There you go. Shoulder is now moving in a better position. I'll take that. All right, Cool. Go ahead and sit up for me there. 3, 2, 1. Stay right there, okay? When you're talking about inverting, you're kind of like getting crushed like that, right?
Yeah, like my feet are up and I'm on my shoulders. I could do it right now, but I might just mess up everything you just did.
No. Like inverting is like your leg is up, you're on your back, like your leg is up.
Yeah.
Okay.
Mostly like on my shoulders, yeah.
You're mostly on your shoulders.
Or like.
There, right, yeah. Okay. Go ahead and hold that. All right, so one of the techniques that Angel loves to do, and every jiu-jitsu practicer has their go-to moves they like to do, is the inversion or inverting. Okay, inverting.
Inverting.
Is okay. One of the go-to moves for jiu-jitsu for Angel is inverting. And what inverting is essentially, your mid-back is pretty much on the mat while the rest of their body is hanging on top, right? And so you can imagine Angel's mid-back is in a flexed position while you have what, a 200-pound-ish male, sweaty, whatever, right? Just putting their weight over. So you can imagine all the tension and stress that she's gonna have on the mid-back, which makes sense why she would have some shoulder issues. And so with that in mind, when we do this adjustment, what we wanna do is actually adjust Angel from a flexed position, because that's the position that is always impacted instead of going into an extension position. So just give this nice tight hug for me. Here, I feel the most compression this way. And I just want you to stay in this position. You're not gonna lean back, okay? So stay here. Yep, I got you. Yep, keep going. There you go. We took care of a lot of the shoulders, and working with Angel for some time now, there has been like a history of like hip, knee, and ankle restriction and sometimes pain. We're not dealing with it right now, but especially we are competing tomorrow, we also want to make sure Angel feels like she's taken care of. So let's take a look. So when we're looking up in terms of dorsiflexion, this is plantar flexion. All right, and they look pretty even to me, even though it just feels like there's some restriction there. But when I come up into dorsiflexion, you can clearly tell that this right foot has a lot less than this left, okay? So, talus, scoop up. Let's see where calcaneus wants to go. A little bit out there. And I feel that spot for Angel. I got you. Okay, and then right here on that cuboid. There you go. So the talus on this foot actually feels okay, which is why the dorsiflexion feels okay, but I do feel a little bit of stuckness here in the metatarsals. This will be a smaller adjustment. And there you go. Sweet, sweet, sweet. All right, Angel, you're gonna roll on your side this way, face me. All right. Thinking about when we first got started with Angel, we're face down on the breath. A lot of the breath was coming from the mid-back. So yeah, there's probably some compression here in the low back pelvic area. So we want to make sure we clean that up for Angel here. Okay. There's L4 here. Big roll, I got you. We'll go right through there. Nice job. Let's go to the other side. So this one, we're gonna take L5, S1 together. So I'm just gonna roll that a bit. Oh, there it goes. If it does adjust on the setup, we just gotta bring that further through. There we go. On your back for me, Angel. All right, last part, just giving Angel some extra love is we're just gonna take that shoulder, work out some of the muscles there for you, okay? So we'll stay here. Biggest thing was gonna keep that right shoulder depressed. My other thumb's gonna pretty much hit teres minor and the lats. And we'll just bring that up. How's that feeling? It's fine, fine, fine. Then we can bring that over. Good. The joints themselves are adjusted. They're in a better position, but now we just gotta allow the muscles now to glide into the good spot here. And last piece, just the front pec minor. Just allowing Angel here to just relax those shoulders, be passive. I'm doing the work. And you see how much further we can get that shoulder now. Good. And awesome. Coming up, 3, 2, 1. Spin that way. Oh, all right, Angel, you just got adjusted. All right, we did get some good movement there in the shoulder. So tell us a little bit how that adjustment flow felt for you and how you're feeling now.
Yeah, it felt really good. My shoulder feels a lot better now compared to when I came in here earlier. And actually my mid-back I feel a lot more relaxed now. I can breathe fully and just more ready to go now. I don't know why, but I mean, I guess I know why, but yeah.
Yeah, absolutely. When the nervous system is functioning at its most optimal capacity, right, the body itself is able to adapt better. And when we're talking about adaptation, we are able to adapt to stress better, especially when we're feeling less compressed. And also saying that we do feel like we can breathe a lot better there.
Yeah, I felt like a lot of my breath was trapped, like you were saying earlier, like I couldn't breathe past my mid-back. So yeah, I feel a lot better now.
Awesome. Well, hey, that's one of the things that we hear a lot in our appointments here is that when people get adjusted, they feel like they can breathe better. And when you breathe better, you can enjoy life more. And when you can enjoy life more, you're able to reach your fullest potential. So best of luck to you tomorrow on your competition. We're rooting for you.
Thank you.
And please let us know whether win or loss. We want to know what's going on with you.
And really quickly, I want to thank you, Howie. Howie sponsors me for Jiu-Jitsu, and he's my first sponsor. And I'm so grateful that you take care of me all the time, and I really appreciate everything you do for me.
Of course. Thank you, Angel. Thanks for coming in. Best of luck to you tomorrow.